So let's draw up some medication from a vial. I have my syringe, I have my needle, I have my medication vial, and I have my alcohol wipe. We're going to pretend that we have to draw up 2 milliliters of medication. I'm going to take the cap off of my vial. I'm going to take my alcohol wipe, and I'm going to scrub that for 30 seconds. Let's pretend I did that for 30 seconds. While that's drying, I'm going to go ahead and take my syringe and I'm going to attach it to the bottom of my needle. Okay, so again, remember that adapter, that lure lock tip. You're going to put it right at the bottom there. You can twist it. I'm going to take that off. Now, because we're going to be giving 2 mLs of medication, I want to make sure that I am pulling back and putting air into the vial of 2 mLs. Okay, so you'll see I'll go right past the 2 mLs. I'm going to take that base of that plunger, put it right at that 2 mL mark. Okay. I'm going to, before I take off the cap of the needle, I'm going to show you. So in the center there, you see that little bullseye center? That's where I want to put the needle at, okay? I don't want to put it outside of the bullseye. I want to put it right in the center of that bullseye there. This is a safety mechanism, so after I'm done injecting the medication, I'm going to push this up. Okay, so we're going to take off our cap. This is my dominant hand. I'm going to turn it upside down. With my non-dominant hand, I'm going to stabilize the vial. I'm going to put this right into the center, push down, and then as you can see, I'll show you over this way, my needle is in that air space. I'm going to push that air into the vial. Okay, I'm going to still keep my hand on the plunger there, invert it upside down. Okay, you see that my needle's in the fluid, and then I'm going to pull back. I'm barely pulling, it's actually just coming down by itself. I'm going to pull back until I get to 2 mLs. Okay, I'm going to pull back actually a little bit more because there is some fluid there, or there is some air at the tip. I don't know if you can see that or not. I'm going to push it back in. Okay, pull it down to 2 mLs. And then voila. So I have my 2 mLs of medication. This is that safety mechanism, because remember, if we actually were going to inject a patient with this, we want to change this needle. We do not want to use that same needle that we injected into that vial to then now go and inject into a patient. So I'm going to push the safety mechanism up. You hear it click. And I'm going to take this off, because if I was to inject a patient, I'm going to make sure I get another new needle and put it at the top. Okay, make sense? Questions? Let me know. Send me a message, leave me a comment. Hopefully this is helpful.